Good evening, everyone. As promised, we'll get started promptly at 6 p.m. So let's kick this off. As I said, I'm Crystal Freitager. I'm the Senior Manager of Academic and Industry Relations with Aspen Dental Management. Aspen Dental Management is a dental support organization. We provide the non-clinical support for the 800 plus Aspen Dental branded practices nationwide. I want to thank everyone for joining my Ask Me Anything session tonight. This is the first in a series of AMAs that I'll be hosting throughout the year. So with that, I have a couple of housekeeping topics that I'd like to clear up for everyone. First of all, yours truly is the moderator this evening, so you'll see me going back and forth between my two screens so I can read the questions that have been posed to the panelists here. I'm going to read those questions, but I really won't be answering those questions. There might be something that's more suited for me to answer, but my three panelists are going to be the experts in it, and they're going to be the ones that are answering those questions. I also want to draw your attention down to the bottom where the Q&A is at. We'll be using that Q&A function today. So I encourage you to pose those questions to the panelists, and I'll certainly present those so we can get those answered for you. We won't be using the hand raising function. We'll strictly stay over to the Q&A function. In addition to that, you may recall that you have a link that was on your Google registration form where you could submit questions prior, and I have several of those that have been submitted. I will also go through those for the panelists as well. I'm going to try my best to get through all of the questions that have been presented in this next hour. And if you have additional questions afterwards, you have my email address, so please don't hesitate to reach out. I also want to put in a plug really quick, and this is for my director. You may have heard that Aspen Dental is supporting free online CEs for dental professionals. And if you want to access those, you can enroll in aspendentalce.com. And again, those are free CEs for people that are in the industry. So I hope you take advantage of that. Now, that being said, I'm going to go ahead and unmute my panelists. I have been very fortunate to have three panelists from three different areas in the business, and I really am looking forward to them introducing themselves and telling you a little bit about themselves. So I'm going to start with Dr. Amy Dietrich. Dr. Dietrich.
Thanks, Crystal. Hi, everyone. I'm Dr. Amy Dietrich. I've been a dentist for 21 years now. My alma mater is the University of Nebraska Medical Center. But I started out in dentistry and private practice. And after years of being in private practice, I needed to take kind of a break and spend some time with my family. So I went to part-time from full-time. And when I was ready to go back to full-time, Aspen was one of those avenues that I looked at. And as I got to learn more about Aspen, it really suited me. It fit the way I practiced, and it really meshed with what my beliefs are. So I just want to thank you all for being here. I'm ready to answer your questions. If you have anything else, I'm sure Crystal can share my email address with you as well. But my role in Aspen now is a director of clinical support, which means that I no longer practice dentistry. I support all the dentists across the organization.
Excellent. Thanks, Dr. Dietrich. They're going to get a very unique view with having you on, so that's awesome. I'm going to go over to Kaylee Dolan.
Good evening, everybody. So I am a hygienist. I've been a hygienist now for 10 years and started out the same as Dr. Dietrich, private practice, and kind of regrouped and found my place in Southern Illinois practice, and my career's just kind of grown from there. So now I'm Senior Director of Hygiene, and I support the hygienists and the doctors throughout the organization here in the Midwest. It's been a fun journey, and there's always been new, Crystal's laughing because she's been with me on all these journeys that life has taken me through, and along the way I've just had this job security and great opportunities with the company.
Excellent. Thanks, Kaylee. And Kim O'Connor.
Hey everyone, so my name's Kim O'Connor. I'm non-clinical support that's on the call tonight as far as answering those types of questions. Definitely don't have a clinical background, and I actually really fell backwards into dentistry. I found my home at Aspen. I've been with a company almost 10 years now and grown within it. To Kaylee's point, the opportunities that the company has offered to me have been endless. I've really grown my career here and can't really imagine being anywhere else now. So yeah, answering all those non-clinical questions for you guys tonight.
Awesome. Thanks, Kim. Appreciate that. Well, let's go ahead and jump in and get started. I've tried to kind of put these questions into buckets so I can hopefully not go back and forth for you guys and keep on a topic. So I'm going to try and do that as much as possible. And I'm going to start off with, because so much is revolving around the COVID atmosphere right now, PPE, and just some of the new regulations. And I have a lot of questions around that. So I'm going to start and get through some of those first, and I'll try and put some of those together. So the first question that I have posed under the in that bucket is really pretty straightforward. They want to know, are we offering virtual care? Dr. Dietrich, do you want to start with that one?
Absolutely. So when the pandemic hit, that was one of the first things that we looked at and really embraced was virtual care dentistry. We used the Doxy platform. So it's doxy.me, Doxy.me, which kind of stands like Doctor Come See Me. So it's kind of cool. But anyway, we actually still have offices that are doing both virtual care and direct care dentistry. But yes, during those first few weeks and month, we did strictly virtual care. And it's a good thing we did, because we were able to get those very emergent people in. And now that we've been able to open to direct care, we're really seeing the floodgates open with people that weren't able to get in.
Excellent. Thank you, Doc. Kaylee or Kim, anything else to add on that on virtual care so far in your experience?
I think Doctor hit the nail on the head, just the access to care. We always joke that we see the patients like Friday evening at 4 o'clock that come in the office right before the weekend. And it was like right before the pandemic, that 4 o'clock patient came in and was like, oh, there's a pandemic going on. So it helped us really be able to see those patients and provide care whenever a lot of other offices were shut down, and also provide jobs for our team members. So it was great for both sides.
Excellent. Thank you, Kaylee. Kim, anything else to add to that?
No, they nailed it. I really like Kaylee's piece on the fact that it helped add jobs for our employees. I mean, obviously we want to make sure that the patients are taken care of, but our team's really important too. And we definitely didn't skip a beat there with making sure that they still had work to come to.
Excellent. And a follow-up piece to that is, how do you handle appointments now amid COVID guidelines? Kim, on the operation side, you might see that from a different angle. Would you like to start with that one?
Yeah, definitely. So I think first and foremost, the biggest thing coming out of COVID was we were all surprised that our demand is crazy right now. Patients want to see us more than ever. We just can't get them in quick enough. But really what we've done, and this kind of goes along with the PPE, which I know we're inevitably going to get into, but we've taken measures to make sure that we have extra time built into the appointments to make sure that our clinical team, along with our patients, are staying safe, that we're able to sterilize things the way that it needs to be done, that we have time to change even into scrubs at the beginning of the day, out of street clothes, have times to get out of our dirty PPE, get into new. So we've had to restructure it slightly, but I think our teams are resilient. We really haven't skipped a beat. And like I said, we're seeing more patients now than ever.
Excellent. Thanks, Kim. And from a clinical side, Dr. Kaylee?
Yeah, I would say that Kim really hit it on the spot. But we also, now that the doors are open again, and we're kind of on the downswing of COVID, and who knows if it's going to come back up again, but we are, the way we handle the PPE and the procedures in the offices are exactly what the ADA and the CDC guidelines recommend. And then we also go a little step further because each state has different recommendations as well. So depending on where you're at, you might have a little bit different regulation than another state may have. But one of the things that we still do, even though we are direct care again, we have patients call in when they arrive at the office. They stay in their car and they call in. And then once we have an operatory ready for them, we go in and we let them come into the operatory. So they don't have to wait in the waiting room. If they do arrive, on a taxi or on the bus, we do have our waiting room set up with social distancing in place. So we are really being careful about keeping our team safe and keeping our patients safe as well.
Awesome. Thank you, Doc. Kaylee, anything that you wanted to add to that?
I think the only thing that we may have missed is just from the patient point of view. So patients are coming in and obviously they have concerns too. They're seeing in the media that, dental hygienists and that doctors are the #1 at-risk career. So they're a little careful whenever they come in. And so like Doc said, just being able to assure them that we're doing everything possible to keep them safe and keep them protected. And I think just giving them structure to their visits. So we give them calls before they even come in and set up and say, hey, wait in your car and we'll call you. We're going to take your temperature, wear a mask. So I think even the patients feel good coming in. They feel like they can trust us and know that they're in good hands.
Great point. I have a follow-up that came through the Q&As, and this is really around COVID as well. And I have, what has been the biggest challenge inside the office since COVID has struck? Who would like to take that one?
I can start on it. I think the biggest challenge in the office has really been that balance. Our teams are motivated. We want to help as many patients as what we possibly can. But to the points the other ladies have made, we want to make sure that everyone's staying safe. So making sure that we're not having crowded waiting rooms, that our operatories aren't overfilling with patients, that, if you need that emotional support guest by your side, what does that look inside the office, and how are we keeping everyone safe while still trying to provide as much care as possible to as many patients as we can.
Excellent. Kaylee or Dr. Dietrich, anything else to add to that?
That's basically what I was going to say. The hardest part is having that little bit of slowdown that we've had to do just to maintain social distancing and keep everybody safe.
Absolutely.
Y'all are going to kill me for saying this, but I think the teams are really missing their free lunches from all the reps. So, the teams will kill me for saying that, but no, in all reality, we are encouraging even social distancing in the break rooms. We're staggering lunches, things like that. We are, guest appearance from the dogs. We are encouraging the teams to social distance even in the break room, staggering lunches, and we are asking only virtual visits from our reps. So that plays a big part in things as well. And obviously we're not getting the free lunches anymore, which is a huge plus.
I agree. I can see that. I absolutely agree. Excellent. Let me, you covered quite a few, and I know we covered PPE at a little bit, but I have a couple other questions, and I want to just make sure we covered everything that they asked. So, Doc, I know you talked a little bit about the process with the patient coming in, and so you covered a lot of this question. The only other part of that question that I think we didn't cover is, do we have anything right now in the offices for air purification?
So we do actually. All of our offices are equipped with Dry Shield and Baculux, which is it's kind of an enhanced high-speed suction system, and there's different studies out there, but it reduces the aerosols tremendously. We also have our docs and the team members, the hygienists, are all wearing, ultra high level PPE, and, being the large organization that we are, we really can leverage that with the vendors in places like Henry Schein. We get the PPE that we need, so we haven't had a problem with that.
Excellent. That actually covers a couple of my questions that I have here, which is awesome. So let me do a follow-up, and I know you touched on this briefly, but I have a question here on how are the offices, or how are you staying informed of the changing recommendations from the CDC, the ADA, and your respective state regulators. So you said that you're getting that information, but I think it's more around how are you getting that information?
So we have several departments through Aspen Dental Management Incorporated. We have legal departments, we have risk management departments, we have clinical departments, which I'm a part of, and we are flooded with email notifications daily on, you know, updates on everything. And I mean, it's almost like you can't even get through them all day, but we don't miss a beat. We're just inundated with all the information coming in from the state level, and then also the ADA and the CDC as well.
Excellent, excellent. Kaylee or Kim, anything else to add with that?
Yeah, I just think, you know, coming off of the fact that we weren't operating on all cylinders when everything first hit, and coming out of that when we were making sure that, you know, the teams were prepared and ready to go, even the fact on how quickly we were able to get that and how organized that information was coming out, I think it was so important that we were able to get that information to the teams even quicker than what they were hearing it like on the news or through media. So they were feeling really safe and really prepared to come back into the buildings and start seeing patients again, just because our teams are so on top of getting that information out to us.
Good to hear. And Kaylee?
They said it all.
Awesome. Thanks so much. So the next question that I have on this is, this is good. Is Aspen still hiring new grads after COVID-19? What will the job outlook look like for the class of 2020 and 21? Who wants to take that? Okay, Doc.
Absolutely, we're hiring. We are not slowing down at all. I think most of you guys know that we open several offices every year, 80 to be exact this year, and we're probably going to open 100 next year. So we are always looking for docs, new grads, docs with experience. But yes, never fear, there will not be a job shortage when it comes to that.
I would agree. And being part of the academic industry relations and talent acquisition side, there is definitely not a shortage of that. So awesome. Kim or Kaylee, anything else to add to that?
Dentistry is the career to be in right now. Dentistry, I feel like, is truly foolproof. The jobs are there. Our demand is high. I think that no matter what role you're coming into in dentistry, there's forever job security with it.
Excellent. Thanks so much, guys. Let me move on to, I think, what might be one of our last around COVID. And that is COVID, since COVID-19 is known to be an airborne disease, and we may have already answered this, so you can let me know if you think we've got a good enough answer out there. Since COVID-19 is known as an airborne disease, what are the guidelines for making sure patients are safe and not contracting the virus in the office? Is there a plan for how long an appointment should last and how long before the next patient can be seen in the same room? So Doc, I know you talked about that we have our lobbies set up, but maybe you could talk specifically to how long, what they've asked with the link between someone can be in that operatory afterwards and how long.
Whenever we have a patient in an operatory where there's been an aerosol procedure, whether it was a filling or a crown, what have you, that operatory is cleaned and it is not used again, probably for the next 2 to 3 hours, because we have several operatories. So anything that's going to be aerosol producing, it's very spaced out from when we go in and out of that room again. I think that covers it.
I think it does. So I appreciate that. Thanks, Doc. I am going to go ahead and switch it up to a couple questions that came in. And see, the first one I have is, what would be a good way for an associate dentist just out of school without any prior exposure to implant procedures to be proficient in it and how long would it take to get there? Doc, it sounds like it's right up your alley.
So yeah, we actually, our senior vice president of implants is a very well-known implantologist, prosthodontist in the world actually, and he has developed a program that will take you through how to restore implants first of all, and then you will restore a certain number of them. You'll kind of pass a proficiency. You'll do case presentations. So it's a rigorous program, but it will walk you through step by step of how to restore implants, to how to sink implants, different ways of sinking implants, bone preservation. I mean, anything that has to do with implants, it's there. And we also employ oral surgeons. So we also have, Dr. Rawal is teaching programs about the zygomatic implants as well. So it's just endless. As far as how long it will take you to do that, it's kind of self-paced, I would say, because some people just want to get through it, you know, from beginning to end as quickly as possible. And I would say that you would definitely be able to get through that in like 6 months if you really put your mind to it. But you don't have to go through it that fast. You can take your time.
Excellent. And let me just bring this other one up because this goes along with it that I have. And this is, how often are you performing implant cases? And maybe Doc, if you're not, since you're on the clinical director side, maybe you could speak to some of our offices and what you're seeing with how often they're performing implant cases.
Yeah, sure. So a lot of our docs who do implants and have been doing implants for a while, they're sinking anywhere from 2 to 5 implants a day. It's slowed down a little bit because of the precautions with COVID, but we do a number of implants. I mean, we started out as a denture business, and we're really growing into not only the denture side of it, but the retained denture side of it. So we got the implant retained dentures and all on fours. So lots of different things to offer the patients.
Excellent. Thanks, Doc. Now, this is going to be an interesting question for all three of you. This is there any advice that Aspen has given that you don't take or you don't agree with? Who wants to start with that?
Can you repeat that question? Any advice?
Yes. Is there any advice from Aspen that you don't take or don't agree with?
That's hard for me because, like I said, when I looked at Aspen as a career choice, it really was right in line with my values and you know, the way I practiced in private practice and the way I wanted to continue to practice. So that's a tough one for me.
Yeah, absolutely. Kaylee or Kim, anything that you want to add for that?
Yeah, I think the more I think about that question, yeah, it's tough right off the bat, but the more I think about it, I feel like anytime that something's been rolled out or announced or changed, there may be that split second to where I'm like, really? Like, is this the best choice? Like, why are we doing this? And every time I have to eat my own words because it's like, okay, I get it now. Like, it does make the most sense. We've kind of talked about it a little bit. I mean, there's a support team for everything within the organization, and they're experts on their subject matter for a reason, and they do know what's best. So I think it's just trusting the process. In my 10 years, I haven't been steered wrong yet. So.
Awesome. Thanks, Kim. Kaylee, anything to add?
I was trying to think of something off the top of hand that I could give an example. I can't think of anything at the moment, but I do feel like here on the hygiene support team, we're definitely heard. So if there's something that's new or rolling out or changing, it's almost presented to us as, hey, what do you think? Let's get all different angles, all different views. We want to work through this before we actually roll it out to the teams to make sure we get the kinks taken care of. So I don't want to come across as like, I have an opinion, I have a voice. And if there's something that I don't agree with or that I don't think is right, I feel like I'm heard. And I think that we work around it to make a plan that is right for everybody. It's hard whenever you've got an organization that's this big.
Mm-hmm.
Everybody happy, but I feel like we take the time to do that. So sorry, I can't think of an example off the top of my head though.
I think
Yeah.
those are great points. Doc,
I
do
think
you want
you're right about that, Kaylee. You know, it's hard to think of something that maybe we don't agree with, but yeah, absolutely. You know, we have over 10,000 people in the organization, so there's bound to be something that you don't agree with, but like Kaylee said, your voice is heard. It doesn't matter if you're a dental assistant or an oral surgeon. I mean, your voice is heard.
Yeah, and that's definitely what's important. Excellent. Thanks, ladies, on that. So let me shift gears to get a couple of these questions that are looks like directed towards hygiene, Kaylee, but everyone else can join in too here. So the first one is are masks the same as always for dental hygienists? And I would imagine that it means maybe because of COVID. So anything changing there with the mask?
Yeah, so we implemented the N95 mask, obviously for high aerosol procedures, level 3 mask over them, also doing face shields. I just got a Snapchat from one of my hygienists down in Mattoon, Illinois today that had a very splattered face shield and just said that she will never practice again without it. So even though all these things are being implemented before COVID, I think that we're learning that if it makes them feel more comfortable in the operatory, by all means, we'll continue it even after COVID. So yeah, definitely changes happened, but I think they're good changes. And if they're preferred, we'll keep them in place.
Excellent. Doctor, anything else to add for that one?
I don't think so. Good job,
Okay.
Kaylee.
And then Kaylee, I have another one. Actually, this could be for anyone, but is there a hygienist in every practice? I've heard the associate sees the hygiene patients. So I don't know where that, maybe we could answer that in a couple different ways.
Kaylee, if you want to start, and then
Yeah.
I'll follow up.
Oh my goodness, yes. Hygienist in every single practice. If not, we are trying to get 2 hygienists in every single practice. The demand is there. It's real. We're definitely feeling it. And so we're really trying to get staffed up to be able to meet that demand. So hygienists, every practice, if not 2 hygienists, and we're actually starting to get some practices with 3 hygienists. Associates, and Doc, I'll let you kind of step into this as well, but generally associates aren't seeing hygiene procedures. That's for the hygienists. They're the specialists in that. So we're going to keep them in their lane and let them do what they're really great at. Not saying that if as an associate you miss picking up that scaler and want to pop off some calculus, go do it. But we don't hear that very often.
Yeah, and that's kind of what I was going to say too, is, you know, everybody kind of stays in their lane, even though we can all perform different things throughout the office. The one time I would say that you will see a doc doing, and mostly it's going to be a hygiene exam rather than a procedure, but is if your hygienist, you have one on vacation and one's sick and you just don't have a hygienist that day, then, you know, we're absolutely not going to call the hygiene patients and say, don't come, right? We're going to take care of those people and it'll be the doctors taking care of them.
Excellent. Thank you. I'm going to go over to Q&A so I can keep up with this one here. And I have, let's see. How much of CAD/CAM 3D printing type of work is done in-house instead of being outsourced to the lab? These would include fabrications of crowns, surgical guides, dentures, etc. Doc, you want to take that one?
Sure. So we've come a long way with CAD/CAM. Every office has their own scanner. There are procedures that we do still have an outside lab fabricate for us. So if your question is, do we have milling units in every office? No, we don't. But we are, I don't want to give anything away, but We're very, very close to being able to do a lot of very new, innovative things with CAD/CAM. And yes, we can make our own surgical guides. Yes, we can make our own crowns, but there is not a milling unit in every office.
It sounds like we might have gotten we heard it first here then, news.
I didn't let any cats out of the bag.
Okay, that's awesome. That's awesome. Okay, let me move on to the next couple of questions. And this one has multiple questions in it. So the first one I have, and I'll give you a couple of them together. It's what hours does a dentist work a week? And how is the average salary for a new dentist in their first year? So who wants to take that one?
I'll take that one. Most of our docs, if you're a full-time doc, you're going to be working, 8 hours a day, and it's 5 days a week. So, if you have 2 docs in your practice, you can kind of trade those off. Sometimes you'll work Tuesday through Saturday. Sometimes you'll work Monday through Friday. It's something that you can really kind of pick and choose, and you have some flexibility with that. But full-time docs are 5 days a week. We do also employ part-time doctors. As far as the salary for a first-year doc, was it just what does a first-year doc make? What was the question?
Average salary for a new dentist in their first year.
Okay, so average salary, if you come in as an associate, your average salary, whether you're a new dentist or an experienced dentist, you're probably going to be making right around $150 as an average. There is no cap or ceiling to what you can make at Aspen, but that would be the average for an associate their first year. And for the lead doctor, it's going to be more probably $200 to $250 a year on average.
Excellent. Thanks, Doc. Anyone else have anything else to add for that one? Okay. The next one I have is, and this should be interesting coming from all 3 of you on your perspectives for this. What does a new dentist find frustrating? Who wants to start with that?
I'll start. I know that this is because I support all the doctors in Aspen. The biggest thing that I see is frustrating coming into Aspen, whether you're from private practice or directly from school, is just the flow of the office and the patient load. Now, I'm talking pre-COVID here because things have changed and we don't have the patient load that we did. But just being able to learn how to move from room to room efficiently and see as many patients as you will a day. And I'm not saying that there's a quota on how many patients you have to see, because that is absolutely not the case. You set your own preferences. You will tell your office manager how much time you need for each procedure. They will schedule accordingly. But just making your way from, say, maybe your procedure that you're doing into the hygiene room to do a hygiene exam, and maybe over to see a new patient and do the new patient exam, that's probably the biggest frustration that I've seen with new docs.
Makes sense. Kim or Kaylee, how about from your perspective of what you've seen or what they've told you?
I think Doc nailed it with the flow. I think that's the hardest piece of it. And for some docs, I think it's just, managing their expectations of themselves. Like, it's going to take a minute to get it. It's going to take a minute to find your rhythm, to find your flow, but we're all here to support you through that. So that's the good news. But yeah, definitely the flow. Nailed it.
Excellent. Thanks, Kim. Kaylee, anything to add?
I feel like there's a lot of hygiene stuff that can get a doc riled up. Whenever we ask them, hey, can you do a probe? That usually doesn't go over very well. We have those overlap on the bite wing x-rays. But honestly, I think that the hygiene doc team works pretty well together, and we try and set them up for success. So
perfect. Thank you, ladies. Okay, let's see. So I guess this is from a lead and an associate. Do all the doctors do all the procedures or only some?
Okay, I want to make sure I'm understanding this correctly. I think what that question is saying is, do we do every single procedure that's out there? Like, do we do all oral surgery? Do we do all endodontics? Do we do, you know, that's what I'm assuming that question is. So that's how I'll answer it.
Okay.
And when you come in as a doc in Aspen Dental, you do what you're comfortable with and no questions asked. So if you love surgery and you want to do surgery, great, you can do surgery. If you love endo, go for it. But nobody is going to tell you that you have to do endo or that you have to do surgery. You have the complete autonomy to refer to, we have in-house oral surgeons and endodontists, you can refer to them. And you can also, if you don't have one in your area, you can refer to an outside specialist if you don't feel comfortable doing a procedure. So just to make it very clear, you work in your comfort zone. Obviously, if you want to grow, we're going to help you, build that comfort zone. So you kind of step out little by little. And, but absolutely nobody's pushing you to do that.
Excellent. And I think you might have helped answer the question right below that. So I'm going to go to this next one, which it says, I've heard that DSOs often lay off dentists that are not able to meet a production amount detailed in their individual contracts. Is this true? What production rate is expected? Kim, you want to start with that one?
Yeah,
or?
I was gonna say, let me at this one. It makes me itchy to hear things like that. So first and foremost, we don't have contracts. It's not a thing. We don't do it. We make offers to our doctors. So your offer really outlines what your daily rate is, what your incentive percentages look like. It's more of that. But again, it's just an offer. I think one of the biggest misconceptions when I'm interviewing providers, dental assistants, anyone, is we don't have quotas. There's nothing out there saying that if you're not doing X amount of, dentures a month, you don't get to work here anymore. It just doesn't happen. I think the best thing that I can say right now, just as an organization overall, I touched on it in the beginning, is our patient demand is up right now. I just don't see it happening that we have areas that are struggling to where we just don't have jobs. I think I'm the most proud of that when I'm talking to friends and family who aren't in dentistry or aren't in or even in our industry, but maybe not with Aspen, is the fact that our response to COVID has allowed us to not have to lay off doctors and field members. Like, we're all still here, we're all still working. And yeah, by all means, it's just an offer, not a contract. And we support our doctors' goals so much. And part of what I do is making sure that if you have a financial goal that you're trying to meet, because of that compensation happening two different ways, and to Doc's previous point that your earning potential is uncapped, if you do have those goals that you want to reach, I'm going to find a way to help you get there. So I know that was kind of a lot more than just what the question asked, but
That's
no
okay.
contracts or quotas here.
Thanks, Kim. Anyone else have anything to add to that?
I do want to add to that, just because I know that this question is in the back of people's minds, even if they don't come out and ask it. And I think this question kind of headed in that direction a little bit. But you guys coming in that are coming in as doctors, you're doctors, and what you treatment plan is what you treatment plan, and that's what you're responsible for. You have complete autonomy. Nobody is saying, you have to do this so many crowns a week or so many implants or anything. That there's no such thing. You see the patients and you determine what's right for that patient, and you treatment plan them the way that you think is best. The only thing that I would say that, part of my job is that we're making sure that we're keeping our patients safe. We don't want to do, and this as well as doctors, the oath that you take, is to do no harm, right? So that's part of my job too, to oversee that and make sure that everybody's safe. And that's pretty much the whole of it. I mean, there's nothing nobody's ever going to tell you what you can or can't do.
Excellent. Thanks, Doc. Keely, what about the same question though, but from the perspective of a hygienist asking the same question? Because I'm sure that's out there too.
Right. And that's one of the things that I love about working here is that we talk about perio, we talk about the condition of the gums, the disease state, and what it can do to the overall body. And I honestly feel like after your hygienist does a full mouth probe and educates the patient, they're ready to get in that chair and get started. So it's not so much about numbers, it's about doing what's right for the patients. Mm-hmm. We'll follow that. And so that's always what I've said from day one since I've started here. And I think that that's really my partnership with the doctors, is just making sure their hygiene business is going in the right direction and we are doing the right things for the patients. And at the end of the day, I think everybody's happy.
Excellent. Thanks, Kaylee. I've got another one that just came in here. It says, because we were kind of on this thread, and you may have already answered most of this, but it says, in terms of percentage of production, how much does an owner doctor make from the production done by the lead doctor? And on average, what % of production does a lead doctor make? Who wants to take that one?
Kim, I think you should tackle that one first.
Yeah, so I want to make sure that I'm understanding correctly. So they're asking like the percentages of how that compensation is earned?
Yep, absolutely. So let's take it in two parts. The easy one, first of all, is on average, what % of production, and I think it's maybe once they understand our model, but
yeah, I was going to say, if I just start explaining the pay model, I think it'll all make a little bit more sense. So I touched on the fact that our doctors are compensated two different ways. You have your daily job, which is really your guaranteed paycheck, I guess, that you know that you're going to get. Because our offices are owned, it's up for negotiation, but I would say on average, most of our doctors are making right around $600 a day. From there, if you're an associate, again, everything's up for negotiation, but typically on average, as coming in as an associate, you're going to see yourself incentivizing on that 8 to 10% range. And that's based on our patient loyalty, because we've all talked keeping our patients happy and healthy is very important to us as well. So that's how that structure works for our associates. Now for our managing clinical directors, our MCDs, same thing, you have your daily rate, you have that guaranteed income that you know you're going to get. But then in addition to that, your sliding scale is going to be based on a 16 to 20% ratio instead. Same criteria, it's on how happy our patients are with us. But yeah, overall, that's really how doctors are compensated, always keeping in mind that because our offices are owned, if there's something specific that you're looking for that still fits in with our guidelines and with our owner's comfort level, that's something that can be negotiated in as we're making our offer, not our contract.
Excellent. And I think if you don't mind, I'll add, and I said I won't add that much, but let me just add too, that one of the things that I think that this is asking too is what % of their production. But I want to remind everyone that all doctors are paid off of the production that the clinic produces, not that an individual provider produces. So every provider within that practice, whether it's a hygienist, an associate, a lead, an oral surgeon, an endodontist, it's off of the monthly production that's produced out of that facility. Would you guys agree with that?
Yeah, absolutely. Good point.
Excellent. And the other part of that is in terms of percentage of production, how much does an owner make from the production done by the lead? So I think it's really just looking for if that owner isn't a lead doctor, how much are they making out of that particular office? Kim, you want to take that one?
I think I might be a little bit confused by the question, because I think you touched on the fact that it's based on the overall gross profit of the office. It's not based on one individual person's production. It truly is team effort, everyone included. And I think it kind of touches on a question that someone asked earlier on if like certain procedures are done by certain people. I think sometimes there's that fear of, if I'm an associate hygienist or if I'm an associate doctor, am I going to stuck being the prophy mill all day? Do I not get to do the fun procedures? Or if I'm an associate dentist, do I get stuck doing, single surface composites all day? Not the case. I think that our ultimate goal is career growth within the company. So ultimately, all of our doctors do a little bit of everything, and that's why everyone's incentivized off of that team effort.
Excellent.
I think that answers it, maybe.
I think so. And I think what I can do, since I know who this is posted by, since he put that on there, I'll go ahead and send them out our compensation model. So they have that for information, just to make sure that we covered specifically the question that he was posing. It could be the moderator is not asking it correctly.
Could be that.
It could be. So let me go over to, every procedure varies in terms of chair time it requires and supply and lab costs associated with it. Among procedures handled by the general dentist, what would be the most profitable procedure and what would be the least profitable procedure? Good question. Who wants to take that?
So I'll take that. I think it really depends on a lot of your preferences as a doctor. What materials you decide to use, what labs you decide to use, because as you know, there's a wide range in materials fees, and there's a wide range in laboratory fees. So a lot of it kind of depends on you, but I would say if you're very lean and mean, Crown and Bridge could be your most profitable procedure. Or if you do a lot of surgery, extract and insert could be your most profitable procedure. I don't think there's really a right or wrong answer to that. It kind of just depends on how you practice.
Excellent. And do you guys have anything else to add, Kim or Kaylee? Okay, excellent. Thanks, Doc. I appreciate that. And moving on to what resources and training programs, and I have two on training. So I'm going to combine these together. So I have what resources and training programs Aspen Dental provides to ensure a smooth transition into clinical practice when you're fresh out of dental school.
So I would love to take that.
Awesome.
And then you guys can touch on it too. I feel like I'm hogging everything.
I have another one from their angle, Doc, another question. So
Okay. So we love having docs fresh out of school. And I really, really feel like we do a good job and our owners do a good job and of really wrapping our arms around you and helping you grow the way that you want to grow as a professional. And we have mentorship programs. So when you join, you will have a mentor. That mentor is going to be with you for as long as you want them to be with you. You will also have not just the one mentor, but you'll have access to myself and two other clinical directors that we're here to help you, support you with whatever you need. But you're going to have that personal local mentor as well. And then as far as programs go, our programs are, wow, we have so many programs. We've got programs for docs almost every 3 months that will take you through, before you start in your office to kind of getting into the nitty gritty and then moving forward with leadership and buying your own practice or becoming a partner with somebody. So there's an endless supply, really. But the mentorship is a big thing.
absolutely. And Kaylee, how about from the aspect of a hygienist, the same type of question?
Yeah, so we want to make sure that the hygienist is on the same page whenever they start with the doctor they're working for. We start them out with a 2-week orientation period, which just really allows them to do what it says, to get orientated, to figure out obviously the flow of the office, the expectations of the doctor. They sit down and do the philosophy of care with doctor. So it's almost like they're an extension of you in order to just hit the ground running once they finish that 2-week orientation period. We have touch bases throughout their career or their life with us to just continue to grow and develop them, whether it be annual meetings, continuing education, our relationship with our vendor partners. We're just always trying to stay on the cutting edge of technology and information whenever it comes to hygiene, so that your hygienist is always up and ready to go. But really, that's the position that I'm in, and the hygiene managers are in, is to that gap between the doctor and the hygienist to make sure that it's just a super, super smooth transition.
Excellent. Thanks, Kaylee. Kim, anything else to add? And the rest of this, the second question that came in, it says, what type of training, what does the training program consist of? I think we probably answered a really good portion between those. Anything else to add, Kim, for that?
I don't think so. I think at the end of the day, just the resources that we have out there, if one of us doesn't know, someone does. There's so many networking opportunities even beyond the initial training. That's one of my pieces that keeps me with Aspen, is that networking and growing piece within the organization.
Wonderful. Thank you. Thank you all. The next question I have is, how do I get student loan repayment? Who wants to take that one?
I can touch on that. So as far as the student loan reimbursement, our recruiters know what locations are offering that. So I know Crystal kind of mentioned in the beginning that your information was available as far as email, things like that. We do have locations that offer student loan reimbursement. We also have others that do not. So if you want to know what locations are out there, which ones are offering, which ones aren't, Crystal's going to be an amazing resource for you to point you in the right direction there.
Awesome. Thanks, Kim. You bet I will. And Kaylee, I also have, do you offer student loan repayment for hygienists?
We absolutely do. Kim knows all about that because we've been working with the market as well. Same thing. So certain positions, remote locations, areas that aren't close to hygiene schools, we offer student loan reimbursement, and it's a really great opportunity to be able to come out of school and work and be debt-free. So it's absolutely an option, and reaching out to the hygiene recruiters is a great place to start. Also checking out our website, you'll see it posted which positions have student loan or sign-on bonuses.
Excellent, very helpful. And we've got about 8 minutes left here, 9 minutes left, so I want to get through a couple of these others. I have, will I do my own treatment planning?
I think we kind of touched on that, and the answer is absolutely yes. You guys are the doctors. You treatment plan what you think needs to be done for the patient and what's best for the patient. So you absolutely do your own treatment planning. If you work in an office with an associate, or there may be 3 doctors in that office, we do want you guys to collaborate a little bit, so that, say Dr. A treatment plans this patient, but the patient can come in tomorrow with Dr. B. We still want that to be a smooth transition. We don't want to make that patient wait until Dr. A can see them, if that makes sense. So yes, you absolutely do your own treatment planning, but you may work from partners' treatment plans as well to get patients in sooner.
Excellent, thanks, Doc. I'm going to move over in the interest of getting a couple more questions in, and I think these two go together. And Kaylee, probably no one better to answer these than you. I have 2 here. The first one says is, do you have to have previous experience working as a clinical RDH with Aspen Dental to be considered for a hygiene support position? And the second one is I'm a hygienist interested in a non-clinical position. Does Aspen Dental have any non-clinical positions available that hygienists can apply for? So I think those kind of go together for you.
Yeah, these 2-part questions get me. Keeping me on toes tonight. So I would say you do not have to previously work for Aspen to join the hygiene support team. Now, with that being said, I do want to preface it with that 90% of our hygiene managers and hygiene directors did come internally. So keep that in mind, but I also say that, and I mean, one of my favorite hygiene managers that's on track to become a DDHS, not that I have favorites, is an external. And so it just goes to show that you can be successful in this organization no matter where you come from. It's just really about that hard work and wanting to understand the culture and grow with the company. And then non-clinical positions for hygienists, oh my goodness, we have hygienists in all aspects of the business. So I'll start off with saying that Lori Deanna, our senior vice president, She is a hygienist. She started with us as a hygienist, and she's just grown her career exponentially. We've got people on our ortho or Invisalign team that came from hygiene, from recruiting, academics. I mean, there's just so many different career paths that you can take. I mean, I think every day I hear of a new position or a new title, and I'm like, I didn't even know this existed, and I've been here for 10 years. So the sky's the limit. I mean, the sky's the limit in all honesty, but I would say if this is something of interest to you, get your foot in the door one way or another, because once you get into this organization, you can only continue to climb. There's so many opportunities.
Excellent. Thanks, Kaylee. I appreciate that. And I'm gonna follow up or end with, because this one's gonna go through each of you guys and it'll kind of get us right to that time, is I have, how have you grown since joining Aspen Dental? So who wants to start out with that one? Because each of you guys, and I don't know if I mentioned this at the beginning, but there's 20 plus years of experience, and Aspen Dental experience in particular with just you three here. So you've been here for some time. So it'd be great to hear a little bit about how you've grown since joining at Aspen Dental.
I'll start. Can you guys hear me? My video is being kind of weird right now, so I want to make sure you can still hear me. So I would say that, before I joined Aspen, I loved dentistry. I still love dentistry, but I was, a hands-on doc. There wasn't a lot of coaching that I did. There wasn't a lot of teaching that I did, and public speaking that I did. And I would say that after joining Aspen, I have really grown in that respect, not only being an MCD or the lead doctor for a year in one of my offices, but also taking this role as director on the management side. I have grown, like, I never thought that I would be teaching. I never thought that I would be doing public speaking in front of huge audiences. And that's really cool because I kind of dig that. But if you don't like that you don't have to do that either. So, but for me, I would say that's the biggest growth that I've had because that's what I was interested in doing.
Pretty cool, Doc. Thank you so much. Who'd like to go next?
Go ahead, Kim.
Okay, I can go next. Oh my gosh, my growth with this company is something I would have never imagined either. My background is not dental. My background is cosmetology of all things. I joined the organization as a receptionist. I thought it was going to be an easy job to be able to go back to school. I knew I didn't want to do cosmetology anymore, but I didn't know what my next step in life was. And the best thing I can say about Aspen, whether you're clinical, non-clinical, whatever your background is before you join the organization, we see those people who want to grow, who want to develop, and who want to do more. And the opportunities there, the coaching is there, the mentorship, the development, the education. To Doctor's point, I'm doing things I would have never dreamed I would be doing at this point. I went from really answering the phone and just trying to figure out what dental terminology was to now I can have conversations with a room full of doctors and actually know what they're talking about. Managed a single unit office for several years with a particular owner and have continued to grow my career to, I've oversaw anywhere from 6 to 12 practices at any given time and provided support to doctors and found a love not only for dentistry, but just really supporting the people who provide it to our patients to begin with. It's definitely a love I have. And I love the fact that our dentists are so passionate about giving, oral health back to our patients. So yeah, the growth is definitely there if you want it.
Excellent. Thanks, Kim. And Kaylee.
I feel like you asked this question because, I cried last time I talked about this. You were setting me up. So I think professionally, I say it all the time. I didn't find dentistry. Dentistry found me. Like I've really discovered who I am as a person just from even what Dr. Dietrich said. Never in a million years would have I thought a girl from small town, Southern Illinois would be up in front of a classroom teaching continuing education and going to these schools and being able to work with students, traveling across the country to meet these amazing people and build relationships. And so it's just been the opportunity that it's brought me professionally, I couldn't have even imagined. This is where I get emotional. Personally, I think that like just the person it's helped me become, and even my husband will say it, is just, you can't wrap your mind around it. Like, I think it's helped me grow as a mom and as a wife. And I'm just so incredibly thankful for all the opportunities that it's given me.
Awesome. I couldn't be more thankful for having you three as my panelists. I hope everyone enjoyed this session tonight. Thank you so much for everyone that joined. And ladies, Dr. Dietrich, Haley, Kim, thank you so much for being transparent and being willing to share your thoughts and answer the questions that were posed. I appreciate you guys. Stay safe. Have a good evening. Good night, everyone.
Hey guys.
Good night, everyone.